Good morning and welcome to Community Connections. I'm Wendy Pyrus, Development Assistant at Family Resources Community Action, a social service organization serving families and individuals in Woonsocket and Northern Rhode Island. For more information about FRCA, you can call 401-766-0900 or visit our website at www.famresri.org. Today we'll be focusing on addiction and recovery, including the upcoming Rally for Recovery event on September 21st. Our guests for today's show are Darlene Magaw, Director of Family Support Services at Family Resources Community Action, and Jaime Savage from the Discovery House. He is the Director. Welcome, everybody.
Thank you.
Good morning,
It's great to be here, Wendy.
Great. So we're going to talk a lot about access to recovery today and wraparound service and ROSC. So let's start with you, Darlene. FRCA leads the statewide Access to Recovery Assessment and Coordination Program in Rhode Island. Can you talk briefly about the program, how many individuals have been served, and what are some of the outcomes you've seen so far?
I sure can, Wendy. Access to Recovery is in its third year of a 4-year grant from the federal agency SAMHSA, and the grant was awarded to Rhode Island through our state behavioral health licensing body. So in the past year, Family Resources has taken the lead role in implementing this grant around the state. And the grant targets a number of at-risk populations, including individuals that are being released from Department of Corrections, the state parole, federal and state probation, completers of residential treatment, individuals that are involved with protective services, DCYF, their parents and caretakers, and women statewide, because we know that women sometimes are affected by multiple issues in addition to substance use, including trauma. And since we began seeing clients in March of 2011, we've serviced over 2,800 clients, and
Wow.
We're currently working with over 120 active clients. We provide assessments through a network that we've established of clinicians around the state, in Woonsocket, at our Family Resources site, in Pawtucket at the Anchor Recovery Center, in Cranston through the Department of Corrections, and at Comprehensive CAP. In Providence at MAP and Discovery House, and Warwick at Anchor Recovery Center, and East Providence, Kodak, East Bay. We also provide care coordination services. We assist clients to access various supports to provide a successful recovery, and we've partnered with 4 agencies around the state to do that. East Bay CAP that I've already mentioned, Comprehensive CAP, Family Services Rhode Island, and STAR in North Kingston.
Oh, that sounds great. What seems to make the difference as far as positive outcomes for the individuals served through ATR?
Well, I think that the grant takes the approach that the recovery process is owned by the client. And so the client makes choices about what it is that they want to focus on during their recovery. So the services that care coordinators can assist them in accessing are things like recovery housing, peer recovery coaching, certainly methadone-assisted treatment, employment services, mental health counseling, psychiatric services, and transportation. We can assist folks with that. We track outcomes using a progress review that's done around 5 months into the program, and what we've found is that the yearly outcomes for all of our clients have been significant in the areas of employment. They've been able to keep stable employment. Their housing is stable. The social supports, who you surround yourself with during recovery is really important. So making sure that the folks that are part of that peer support network are folks that are going to be giving healthy messages about next steps. And certainly sobriety, being able to stay on course with their recovery. And making the choices themselves, not necessarily being pushed from behind, but saying, this is what I want with my life.
Great. Sounds like it's a total wraparound care.
Yes.
Great. So, Jaime, could you talk about the mission and the philosophy of Discovery House for us?
Oh, sure. I mean, if I can just start, and we have 2 locations in Rhode Island. We have one in Woonsocket and one in Providence on Pavilion Avenue. Discovery's been around since the 80s. We provide 3 levels of different services. We have methadone maintenance, we have Suboxone treatment, and drug-free as well. And our mission is more about providing these, so to speak, wraparound services, comprehensive services for people who are affected by addiction through community awareness, through quality and holistic clinical services. So, we also try to, actually we do, make sure we're providing an efficient, safe, sound environment for our patients. We are, folks that come through our treatment, we ensure that we treat them with respect and dignity, and I really feel that most of our patients that come through our door really feel that. We also believe that, methadone maintenance it's more of an effective treatment for individuals who are addicted to opiates. And we also combine that with outpatient counseling, groups, and a lot of other different sort of ancillary services to support people through the recovery. There isn't necessarily a script or prescription for recovery. Each person going through recovery, it's their own personal journey, and we really incorporate that within our treatment program.
Fantastic. So Rhode Island has been chosen for the national site this year for the Rally for Recovery, which is on September 21st.
So exciting.
Could either of you discuss a little bit or let our listeners know about the upcoming rally?
I can start. Last year we participated as an agency, and it was just an amazing day. Joyous in that so many people there with their families celebrating their recovery, but also a hub of information for people that are looking to begin their journey. There's music, there's fun, and the day ends with some memories of folks who have struggled with recovery and honoring their struggles.
Great. How about the location? Could you give our listeners the location?
Sure. It's the Roger Williams National Memorial, which is in downtown Providence, right along the river. And like I said, there's food, there's music, and many, many people that are celebrating life.
Fantastic.
Starts at 2 and I believe goes until 7.
Right. And actually, I'm really excited about this event for myself personally. This will be the first time that I'll be joining myself to the rally. But Discovery House has participated in each rally, and we're really committed and proud to be one of the donors as well in supporting the rally. So I'm personally looking forward to experience the family connections and the listening to folks their stories on their journey to recovery. So I'm really looking forward to it.
Fantastic. It sounds like a great event. So Rhode Island has also recently been chosen as a pilot project for health homes, which is a wraparound care with heavy case management for high-risk individuals. Could either one of you talk about this a little?
Sure, I can go into that a little bit more. Health homes is developed for high-risk folks that are on Medicaid. And basically, it's the connection to community providers, doctors, their therapist, and using high-level case management in order to connect folks to their primary care. Folks that may have missed their physical, or folks who haven't been to the doctors for a long time. There are a lot of aspects to this. It's a very general social ecological model perspective with the health homes piece. There's heavy case management by nurses and case managers that will support folks to improve their wellness. It's a general wellness program. I mean, there are great services out there. We could be connecting people to yoga if it's part of their recovery. We could be connecting to a lot of different holistic services. So, we're really excited about this, and really to provide a lot of other services that may not have otherwise been provided under different models. And it's really about having our patients collectively have better health. When you have better health, you feel better. When you feel better, you have more positive thoughts about where you are in your recovery, and longer life, and a more happier life, so to speak.
Great. Is there anything you want to add, Darlene?
One of the nice things about that is that it's so individualized.
Yeah.
Whereas, in the past, there'd be sort of this, you can choose from these 3 things. And now it's really led by the person's belief about what's going to work for me. And that makes such a difference in engagement when in any type of change process, that the person is deciding what they want to do. And if it's yoga or if it's a cooking class, learning about nutrition, those things can be brought into it. And it's such a strength-based model.
Absolutely.
Fantastic. Another topic for discussion is the federal movement to move toward recovery-oriented system of care, ROSC.
Yes.
Could either one of you discuss this a little?
Absolutely. I mean, the ROSC is it's also sort of built into this health home models. It overlaps. Basically, ROSC is just a coordination of networks of community-based services, and it supports basically what Darlene was just saying, person-centered, and it builds on the strengths and resiliencies of individuals, families, and their communities. It's really taking a look at aligning with our patients. You know, you hear about modalities out there, you know, in substance treatment, you need to pull yourself up by your bootstraps, or that you need to hit rock bottom. That's sort of really moving away for therapists and for clinicians and providers to align with their patients, because it's their treatment. I mean,